Childhood immunizations are an important part of staying healthy and preventing serious illness throughout our lives. Immunizations are not new. The first vaccines were introduced in the late 1700s. Since then, immunizations have slowed or completely stopped the spread of many serious diseases, like smallpox and polio, and have saved millions of children's lives around the world. Vaccines are seen as one of the greatest public health tools ever created. But what are vaccines and how do they work? When we get vaccinated, we are teaching our body how to fight off certain diseases. First, a weak or a dead form of the disease is introduced into the body. Our immune system then reacts to this intruder. It identifies the disease, then makes specific antibodies to get rid of it. If ever we are exposed to the disease again, our body is ready. It already knows how to make the necessary antibodies. Thanks to the vaccine, your body has learned to keep itself safe without the health risks that come with catching the real form of the disease. Why should we get vaccinated? Well, for one, if we get exposed to a disease, we will be protected. We'll get less sick, or we won't get sick at all. If we don't get vaccinated, though, we are at greater risk of getting infected. When we are sick, we can easily spread a disease to other people who can also get sick and spread the disease. The more the disease spreads, the more likely it will reach the more vulnerable members of our community. When we get vaccinated, we are protecting ourselves and others. Throughout your life, there will be many opportunities to get vaccinated. Different vaccines are offered at different times, but they all work to protect us and our community from severe illness. Infancy is the best time to get immunized. Before a baby is born, it is protected by its mother's immune system. After birth, this protection fades quickly. This leaves babies vulnerable and at a high risk of getting really sick. Some serious diseases include hepatitis B, whooping cough, measles, mumps, chickenpox, and meningitis. There are also certain bacteria that can cause pneumonias and other diseases. These are all potentially life-threatening, or could have long-lasting consequences to children. Luckily, we have immunizations to teach babies' immune systems to protect them against all of these. In the Northwest Territories, babies will be offered these vaccines according to a schedule, between right after birth and their 18-month appointment. They will get their first vaccine before they even leave the hospital. We want to start immunizations in infancy, not only to protect babies, but also, since they haven't been exposed to a lot of disease yet, their immune systems are ready to learn. Other vaccines are also given around kindergarten, grade 7, and later on as well, to keep protecting children from disease as they grow. Your baby will likely get multiple immunizations during an appointment, and this is okay. A baby's immune system will not be overwhelmed or weakened by having more than one vaccine. Multiple immunizations will make their immune system stronger and protect them from disease sooner. Sometimes your baby will need more than one dose of a vaccine to give them the best protection against disease. Multiple doses work to build immunity that is high enough to provide them with the best protection. It takes time for a baby to build their brand new immune system. To protect a new baby, everyone around them, including parents, family members, and others, should also be vaccinated. Vaccines are still really important. We don't see a lot of severe and scary diseases like polio or smallpox anymore. But this isn't because they don't exist anymore. It's because widespread vaccination is protecting us and our communities. Unfortunately, in places where immunization rates are low, some illnesses that were previously rare, like measles, are being seen again. These diseases from the past are vaccine preventable. This means that by getting vaccinated against them, we can protect ourselves and we can keep our community immunity high and prevent the diseases from making a comeback. Vaccines are safe and go through a lot of testing before they are available to the public. Vaccines help keep kids healthy, and when kids are healthy, they can focus on growing and exploring and having fun. In the NWT, if you want to learn more about early childhood immunization, there are several reliable sources of information. Visit the Can Immunize website or the GNWT Department of Health and Social Services website. Download the Can Immunize app or speak with your or your child's healthcare provider. For more information on the NWT vaccine schedule and early childhood immunizations, please visit the webpage below. If you want to book a vaccine appointment for yourself or your child, contact your local health center or public health unit. Together, we can build our children, families, and communities' immunity from serious disease.